Hey everybody, my name is Dennis Kelleher, and today we're going to discuss the one topic most people don't think about when planning for retirement: medical costs. Sadly, healthcare costs continue to rise and most of us are living longer, so it's important to plan for future medical expenses. If you don't do it, you could have a big impact on your savings later. Let's dive in. Today I want to cover 4 essential aspects of medical expenses and ways you can manage them. Understand the costs, your options for coverage, explore how to pay for it, plan for it. First, let me ask you a question. How much do you think healthcare will cost you in retirement? It might be more than you think. Research shows that an average couple retiring at age 65 today may need over $300,000 for out-of-pocket healthcare costs. One would need roughly half that if single. Of course, this number could be different for you. For a quick view of what to expect, log into your retirement account and check out My Orange Money. You'll have the option to see how much to expect in healthcare cost each month in retirement. What should you consider when planning your own healthcare costs? First of all, Americans are living longer, and even if you're healthy, staying fit and regular health services can cost a lot of money over time, especially for women who live longer than men. Chronic conditions such as diabetes require lifelong care and have higher costs for treatment. Medicare won't cover everything, and the higher your income, the more you'll have to pay for premiums. Also, should you need assisted living or long-term care, the cost for those facilities can be very expensive. When you leave work, you may leave behind benefits and any group policy savings as well. So now what? There are many things you can do now to prepare yourself. Let's start with the types of insurances you have. Write these down on a piece of paper and check off the ones you already have so you can quickly identify where you might have gaps. Health insurance to protect your family from the potential financial impact of medical events. If you have a high deductible health plan, you'll need to be able to cover medical expenses before you hit the deductible. A health savings account is designed to save for and pay for qualified medical expenses and reduce your taxable income. Disability insurance to protect your current income should you become unable to work due to illness or injury. Protect your family and buy life insurance to cover expenses left behind. Critical illness and accident insurance to offset unexpected healthcare events. Long-term care insurance in the event you can no longer care for yourself at home. As you head toward retirement, you'll have other options. Let's learn a little bit more about what might be available so you can start planning. Basically, there are 3 categories of varied coverage: government-based, which is Medicare, Medicaid, and military employee-related coverage; employer-based, such as high-deductible private coverage, HSAs, if available, and possibly retiree medical insurance if offered. Supplemental insurance includes Medigap insurance, private coverage before Medicare kicks in and after to fill in the gaps. Let's talk a little more about Medicare. Medicare is a federal government-sponsored insurance plan for Americans 65 and older. Here's a few quick facts. Medicare doesn't cover everything, only about 51% of eligible costs. Eligibility to sign up starts at the age of 65, and you have to enroll at the right time to avoid penalties. Medicare is not free. You must pay premiums. Coverage is offered for individuals only. You can't be covered jointly. It's designed to cover catastrophic and limited medical coverage. If you decide to work past 65, there are some special considerations. It does not cover things like long-term care, dental, vision, hearing aids, etc. You may need supplemental gap coverage. Learn more at Medicare.gov. Medicaid is a government program that provides a healthcare safety net if you need it. For example, in retirement, people can utilize Medicaid if they run out of money and need nursing home care. There are lots of rules and considerations, so visit Medicaid.gov to learn more. Supplemental insurance is extra insurance you can purchase to help pay for out-of-pocket expenses for expenses that Medicare does not cover. There are 2 types. Employer-provided benefit. If you are still employed and reach 65, check with HR and Medicare to understand how private insurance and Medicare work together. and a Medigap policy that you purchase to cover what Medicare does not. We've talked about the costs and some coverage options you may have. Now let's focus on what you can do now to prepare. First, start identifying providers of safe and cost-effective healthcare services such as primary care physicians, specialists, urgent care, etc. before you need care, and if you are younger, consider looking into long-term care insurance now. Think about where you might want to live when you retire and how taxes or other costs and health services might factor into that decision. Save as much as you can in retirement plans and IRAs, and if you are 50 or over, take advantage of catch-up contributions which allow you to save even more for retirement. Focus on developing healthy habits which can help keep healthcare costs down. If you are working and have high deductible health plan, save in a health savings account if you aren't already. Also, make sure you understand and are taking advantage of other benefits offered through work. To do all of this, you need a plan. Consider working with a financial professional to help you. Estimate the full cost of retirement, including health care. Understand all sources of income, including Social Security and pension strategies. Make sure to include healthcare costs into your income planning needs. Determine your personal health insurance options to include Medicare, employer, supplemental, and health savings accounts. Help you determine how much you should be saving to meet your estimated future expenses. Don't forget to make adjustments to your plan so your money will last you throughout your lifetime. Quick recap. Plan for all future costs in retirement and beyond. Then evaluate your options and consider getting protection you need and add it to your overall plan. If you need help, work with a professional. Don't forget to give yourself permission to have a little fun. Live a little, save a little, and remember it's never too late to start getting your finances in order so you can live the best life you can envision. Best of luck, and thank you for joining our session on healthcare expenses. And be sure to stop back for more videos on some of the topics we covered today so you can retire well.